being a conversation revolving around the health of our joints. Mhm. And tonight we have the honor and privilege of having Dr. Philemon Nyambati all the way from AICQ Kijabe. And how are you, Doc?
Fine, thank you.
It's been a while. I think the last time you were here, it was last year.
Yes.
So how is the practice there at Kijabe?
Great. We're continuing serving children, and we're just grateful for every day that the Lord has given us. Every time you have breath of life, it's good to serve the best we can. Thank you.
Yeah, and you told me a while ago you were just from the clinic, and you said,
Yes.
I have to rush to ensure that I catch the program, and it's good to have you here with us tonight.
Thank you.
All right. And as we alluded to tonight, we just want to have a conversation regarding healthy joints. And we'll start with Dr. giving us a bit of an explanation about what joints are and their importance in the human body. You know, right from the childhood or from a child to an adult. What's the importance of the joints that we have?
Thank you. So when we talk about joints, just part of the body, this is what actually helps the person move from one place to another, is able to bend to try to reach on things because we are not stiff. We have many parts of the body that helps with movement. There's the bones that are structural, that helps protect our organs and helps us to move from one place. Then there's the joints that now connect, let's say if it's the knee, that connects the lower leg and the upper leg being called femur in our practice, and the lower one called tibia. And so between that, there's the joint that's called a knee joint. So there are multiple joints in the body, something that can help you reach out to things. We can start from first the back. We have the joints of the spine. There are multiple joints within the spine that helps you turn your neck, bend forward. Then we have coming to the shoulder or to the upper limbs, there's the shoulder. Then there's the elbow. There's what is called the wrist joint. That's what attaches the bones of the hand to the arm, it's called forearm. That's what helps you reach out to things. Then when you come down to the lower legs, if I can use that word, we have what is called the pelvis, which is attached to the hip. That's what actually helps you sit, move, run, walk. Then going down, we have what is called the knee joint, and the joint of the foot is called the ankle. And so all this, the human is a complex system, but it helps us move from one place to another. And joint is just not one part. There are multiple parts within a joint. It comprises of muscles. It has cartilage. That's actually what helps lubricate the joint. That's what produces fluid to help lubricate the joint. It's soft. It has what is called synovium, that now what helps produce the joint fluid. Then there's what is called the tendons that attach from between the joint, or one part of the joint to another. If I can use focus on the knee, because that's what we see common children coming with to clinic. So what we have is the knee joint. So the knee joint has 3 bones. So there's what is called the femur, which is the thigh bone, the tibia, which is the shin bone, and there's usually a bone that's actually in front that's called the patella. So all that's now part of the bony part. So we have the muscular part, which has tendons and that help hold the knee so that is able to move from outside. Then we have ligaments that are within the joint inside. So all this actually helps move and position the joint so that when you're able to move, you're not able to lose balance easily. And when you're walking, you're able to balance. So this actually gives feedback to the brain, so that when you're walking in a place that's not as stable, you're able to balance itself. This is just one of the joints. Yeah. Then there's also in children, what they have is growth plates, because children are still growing. So from when they are young to actually around, for girls it's probably around 14, 15. Boys can be 17 to 18. They have growth plates within the knee joint. So that is what helps them grow. And so at times this can be where there's attachment of the ligaments themselves. This actually brings pain. Actually, they're called growing pains, because at that time, as they're beginning now to mature to become adults, it starts now closing up the growth plate, so that it can attach the growth plate with the actual shin bone, and when they're growing up. But at that point, it becomes a weak spot, or when they are very active, they can have overuse, and so that can cause pain on the knee. So there's what is called in layman it's called growing pain, but in our term there's what is called Osgood-Schlatter disease. So this is a condition that happens. So there's a attachment of what is called the patella tendon. That is what attaches the patella onto the shin bone, and it's closer to where the growth plate is. And so at that point, if there's because there at that time it tends to be a weak spot, so it tends to have pain and swelling as they keep on running, playing. So a child could be playing. As they're playing, they're not feeling any pain, but as they continue, at the end of the day, probably when they're resting, they feel the pain. So that actually happens with it's called growing pain, because at that point it's a weak spot, because when the bone is beginning to not really fuse, but the growth plate is beginning to fuse and attach at that point, it's prone to stretching. So that's one of the areas. There are many other things that can cause joint pains. So you can have injury that can happen within the joint itself. You can have ligament injury, and you can have also infection. There can be infection that can happen. Either it's from any other place, like someone could have a toothache, a sore throat, and it can go through the blood system into the joint, and that can cause swelling and pain and other things like fever. So something like that, it will be good to see the doctor, go to the hospital, and actually examined, and so that they can drain it, because if there's any infection within the joint, it's not a good sign. And so yes, so that's what I can start as an introduction. Yes,
it's good that you have mentioned about what you experience, especially in your practice at QA International. And for adults,
yes,
is there any area that you would say many people would complain about their joints?
Yes. So adults, yes, also. So there's the child group, the children age group, where there's a risk of infection. As they are becoming adolescents, there are the growing pains where there's attachment of the tendons. They can have in multiple places. I just use the knee as an example. Then as we come to the young to middle age, at this time they're really active, sporty. You're going to work, you're having sports, probably the weekend or within, or you're a runner. So they're prone to also having, if you don't have the proper shoes or you don't stretch enough, there's risk of injury, ligament injury within the joint, or some tendons can get injured. Then that's between 20 to around 40. Then as you're going, but there are also other things that can happen in that age group, because there are people who go to work and are active in country building. There's a risk of accidents that can happen, or falls, depending on their work, if they are working in a building, and so they can injure their joints. And then we come to around 50, 60 at this point, because there's wear and tear. And so what happens within the joints it begins wearing off, and so actually this is where there's what is called arthritis that can happen. This can be caused by many things. There can be an injury that could have happened long time and was treated, but happens to now develop arthritis. There's also, if someone is a bit on the heavier side, overweight, that causes stress in the joints, and that can cause wear and tear. Also, if someone is sporty and they do not have the right shoes, the excessive impact also causes pain. And so that's what I can give in terms of the profile from young to adult as they go into elderly. Yes.
Right. All in nation building, sporting activities, and
Yes.
just life as it comes.
Yes.
So, Dr. Riddle, I need to find out then.
Yes.
What are the warning signs or symptoms that indicate someone should seek medical attention for joint pain or discomfort, right from childhood, maybe adolescent, or even for the adults?
Yes. So, well, the thing that initially there can be injury that can happen. So if you have joint pains, like for young children, one thing you have to watch out for is, especially if they are young, they are not breastfeeding because they have severe pain. They do not want to move that joint. They do not want it touched. Probably they do not breastfeed, or they do not want to eat, and they have a fever. That is a warning sign that you actually need to seek medical advice. Then as they come to adolescence, as they are active and sporty, it can happen probably as they are running, they fall and they injure ligament within the knee, and so it tends to swell, or they do not have anything, they're not able to walk. It's good at least to seek advice, because it could be within the knee that there's an injury that has happened. And so when they are not able to walk and not able to use it, or there's a swelling that happens all of a sudden, it shows that there could be something that has got injured. Also, if there's any if they have joint pains, and there could be multiple, because there are some that are systemic. There's what is called rheumatoid arthritis, juvenile rheumatoid, that happens in children, and there's what is called rheumatoid arthritis. So this is a systemic disease whereby the actual cells of the body attack the joints. So this causes pain, swelling, and they have some stiffness. So if you find that you're having this, there are multiple areas, just not only one side, it will be good to seek advice. At this point, it's good to seek at least a rheumatology or a clinician just to see you, and actually they're able to do some tests just to check what could be the problem. Then as you're coming now towards the older age group, first there's the young age group, the 20 to 40 going 50, they are prone to injuries, either a fracture, something can break within the joint itself. So that it will be good to seek advice. Or if there's they have clicks, that joint pain that has clicks, you can have clicks. The joints can click. That is because when there's air trapped within the joint, so it bursts out, and so it acts as a click. But if there's pain, if you have joint pain and you have a click and you are not able to move, it will be good to seek advice. And so that will be when it would be good to seek advice. Yeah. In all of them, they can also be prone to infection. And so this can come to have, maybe they have swelling within the joint, it's swollen, they have fever, they do not want to move. It will be good to seek advice. They're also the older age group, they're still prone to infection. But the major part they tend to have is mainly sports injuries. Yes.
Now that we have mentioned regarding those conditions and all, I believe there some could be severe that would need probably medical intervention,
Yes.
surgical intervention and
Yes.
all.
Yes.
So could you share with us some of the treatment options whenever somebody presents, if it's a child, especially for your practice, and even
Yes.
for the young people and the adults, what are the treatment options?
So once a child comes, they probably have been having. It depends on what they actually have. So in the case of the growing pains when they have, which is the adolescent age group as they come, what the complaint will be that they're having some swelling just on the front part of the shin bone on the top, and they have pain. They're not they when they play, they're able to play or run. Then when they stop when the day ends or when they're not active, they feel some pain. And so with this, we're able to actually examine and just do what is called an X-ray or a radiograph, and just check if there's nothing within that, and it's mainly that type of growing pain. What we actually advise intervention is non-surgical. So we actually first recommend, if they are very sporty, it's good to um, hold off sports first for a while, just have rest, and they're taught stretching exercises by the rehabilitation team. And also when they have the pain that they're at that point when they're not able even to move, and you're certain that it's that, what is done is we recommend either cold compresses or just warm compresses, just to help with the pain, and then also some medication that can be bought just to help with the pain. But also it will be good, in addition just to the X-ray, blood work is also taken just to rule out if there's anything. If the blood work is okay, then that rules it out. If they have any form of injury that you suspect, the further imaging that's usually done to check within if there are any ligamental injuries, and with that they may need some intervention to fix if they're having injuries within the knee. For joint health, first it will be good to have a healthy diet. Make sure that you're well hydrated, lean protein, fruits, vegetables, and as you're active, before either doing some intense activity, not only intense, even just generally, it will be good to stretch, because the joint is not only made up of the joint itself and the bones, it's also made of the muscles. So you need to prime the muscles just so that you're able to walk well, and that they're able to sustain strength, and so you're not able to have pain. So it's good to have stretching exercises that you can start before either running, walking, or even playing sports, because all that, there's a risk of that. And then if probably you're at work and then you say just in the weekend as a young person that you're just going to play sports, if you're not really stretching or strengthening your muscles, there's risk of injury to the joints. And so one thing also we encourage also is weight loss, just to help with because the heavier someone is, the more stress the joint is prone to having, because it doesn't change if the body weight changes, and so it's carrying the same weight and it's carrying a heavier person, and so that brings stress to the joints. And also the type of shoes, good to have runners, especially when you're walking or running. They're good shoes that are helpful, not something that's very flat, because that is prone to just causing stress into the joint. So those are some of the remedies that can be done, especially in maintenance of joint health. Yes.
All right. You had alluded to matters nutrition, and I see a listener here who is already asking a question and saying, can Daktari tell us about taking or even drinking bone soup or broth in relation to bone cartilage and joint health? That is from David Domo from Thika.
Thank you, David. So bone soup itself, it helps with mainly because it's a source of calcium and also protein, and so it just helps with mainly as a source of protein and calcium. In terms of replenishing joint fluid, that hasn't been found to help. It just helps with that part of health in terms of it's highly nutritious. And so because when you have a bone, there's the accessibility to the calcium, and so that is what actually helps with the bone. But the mainstay, if there's a problem with joints, more often than not, it will be good to first protect them, because one thing is that the cartilage itself, once there's growth, there's no form of the nutrition that it gets is just within the joint fluid itself. Yes. So the calcium, the bone soup itself does not increase joint or make the joint healthy, but it's something that's good to just help with the body. Yes.
And still on that, you had mentioned a few of other areas specifically. Which are these probably fruits or even food substances that one should consider when they are thinking about the health of their joints?
So food, so there's the lean protein that's recommended, but one thing I'll say, it's about moderation.
Okay.
So if it's meat, let it be lean meat, but someone should not overuse fruits and vegetables.
Yes.
So there are many, just depends on the season, because you can't say that you'll get probably a fruit from Thailand. You have to think about what
Yes.
is local within the country. If it's oranges, apples, grapes, guavas, and so all this actually help with a healthy body, not only specific for the joint, but it helps with the body. There's also vegetables, any kind of vegetables. So all this just helps with in terms of body nutrition. So that's one thing. It's not specific to the joint. Yes.
All right. Tonight we are hosting Dr. Philemon Nyambati, all the way from AICQI International, talking about the health of your joints, and we're still learning a lot. You are welcome to send your questions or your comments to 20933 or WhatsApp on 0717400555. Just to remind you, we are live on Facebook, on YouTube, as well as on X, where we are beaming live this content for you to be able to interact with it, and also at some point you would like to refer to this conversation, yes, you have the opportunity to do so. And so we'll carry on with that in a little while. But before then, I need to remind you, at the top of the hour, we have Fresh with Bunny, and then a little later on, we'll be having the Artist of the Week segment, and we are featuring an artist, not an artist, actually three artists there together, coming with the name Phillips, Greg, and Dean. Yes, so you'll be listening to their song at the top of the hour, and also a quick look at the weather as well. Before we carry on with the conversation in the next hour, I need to let you know that you're most welcome to be part of Acacia that we are having this Friday.
Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.
I've actually been trying to find a balance. It's been really tough and hectic, but everyone says once you get a hang of it, it becomes better. And I don't know, but I'm hoping to find a balance soon because it's really been hectic. But you've been in the job industry for a long time, so I think you would know better, Sindio.
Huh? What time is it? I need to catch up on Leadership Forum. Do they have a radio here? Never mind. I broke my own.
No way. You can't be serious. Wait, why do you have a radio and you can just catch up with the shows on Hope FM podcasts?
Really? Even Miss of the What?
Yeah, I mean, you can find them on whatever platform, name it. AfriPods, Google Podcasts, Apple Podcasts, Spotify, you name it.
But I'm not subscribed on any of them.
Oh, no worries. You can just check out the latest episodes on hopemediakenya.org.
You can now listen to select Hope FM programs on your favorite podcast streaming platform or directly on our website www.hopemediakenya.org. Listen and live.
I've actually been trying to find a balance. It's been really tough and hectic, but everyone says once you get a hang of it, it becomes better. And I don't know, but I'm hoping to find a balance soon because it's really been hectic. But you've been in the job industry for a long time, so I think you would know better, Sindio.
Huh? What time is it? I need to catch up on Leadership Forum. Do they have a radio here? Never mind. I broke my own.
No way. You can't be serious. Wait, why do you have a radio and you can just catch up with the shows on Hope FM podcasts?
Really? Even Miss of the What?
Yeah, I mean, you can find them on whatever platform, name it. AfriPods, Google Podcasts, Apple Podcasts, Spotify, you name it.
But I'm not subscribed on any of them.
Oh, no worries. You can just check out the latest episodes on hopemediakenya.org.
You can now listen to select Hope FM programs on your favorite podcast streaming platform or directly on our website www.hopemediakenya.org. Listen and live.
I've actually been trying to find a balance. It's been really tough and hectic, but everyone says once you get a hang of it, it becomes better. And I don't know, but I'm hoping to find a balance soon because it's really been hectic. But you've been in the job industry for a long time, so I think you would know better, Sindio.
Huh? What time is it? I need to catch up on Leadership Forum. Do they have a radio here? Never mind. I broke my own.
No way. You can't be serious. Wait, why do you have a radio and you can just catch up with the shows on Hope FM podcasts?
Really? Even Miss of the What?
Yeah, I mean, you can find them on whatever platform, name it. AfriPods, Google Podcasts, Apple Podcasts, Spotify, you name it.
But I'm not subscribed on any of them.
Oh, no worries. You can just check out the latest episodes on hopemediakenya.org.
You can now listen to select Hope FM programs on your favorite podcast streaming platform or directly on our website www.hopemediakenya.org. Listen and live.
I've actually been trying to find a balance. It's been really tough and hectic, but everyone says once you get a hang of it, it becomes better. And I don't know, but I'm hoping to find a balance soon because it's really been hectic. But you've been in the job industry for a long time, so I think you would know better, Sindio.
Huh? What time is it? I need to catch up on Leadership Forum. Do they have a radio here? Never mind. I brought my own.
No way. You can't be serious. Wait, why do you have a radio and you can just catch up with the shows on Hope FM podcasts?
Really? Even Miss of the What?
Yeah, I mean, you can find them on whatever platform, name it. AfriPods, Google Podcasts, Apple Podcasts, Spotify, you name it.
But I'm not subscribed on any of them.
Oh, no worries. You can just check out the latest episodes on hopemediakenya.org.
You can now listen to select Hope FM programs on your favorite podcast streaming platform or directly on our website www.hopemediakenya.org. Listen and live. Welcome to the world of Hope Media, a media unit of Christ is the Answer Ministries that is committed to spreading the gospel of our Lord Jesus Christ through the transformative power of media. Hope Media is dedicated to utilizing various forms of media to spread the message of hope, love, and redemption to all people around the world. Hope Media consists of various units that work together to achieve this goal. These units include Hope FM. Hope FM is your number one Christian radio station offering you discussions on current day-to-day issues, inspiring music, life-changing sermons, and news updates, broadcasting 80% in English and 20% in Swahili, with listenership of over 12 million every month. Hope TV. Hope TV programming is designed to inspire, educate, and challenge the viewer with wholesome content to reach various demographic groups, children, youth, and adults, both male and female, with viewership of over 24 million every month. Hope Recording Studios. Hope Recording Studios is a state-of-the-art recording facility that offers high-quality recording, mixing, and mastering services. It is designed to meet the needs of musicians, artists, and other creative professionals who require top-notch recording facilities. Hope Creative. At Hope Creatives, we believe that inspiring graphic design work doesn't just happen. It takes the right people with wild out-of-the-box ideas committed to the same ideals, working together to make it happen. We listen, we learn, we brand. Hope Digital. Hope Digital is a creative digital unit within Hope Media. We are driven by a passion to creatively express ourselves while influencing you with the same creative energy in online spaces and beyond. At Hope Media, we believe that media can be a powerful tool for spreading the message of hope as well as grow your business through advertisements, and we do this with excellence. For more information regarding our services, please visit www.hopemediakenya.org or call us on 0709 861 180. Hope Media. We keep hope alive.
In their faith, and Philip, Craig, and Dean's music continues to be cherished by fans around the world, and their songs are frequently sung in churches and Christian gatherings, and their harmonies, heartfelt lyrics, and commitment to worship have made them enduring figures in the contemporary Christian music scene. And this week, we've been featuring them in the Artist of the Week segment. And so we continue here on Breath of Heaven to learn. Yeah, we're learning more about the health of our bones, and specifically looking at the joints, the health of our joints. And helping us tonight, we have Dr. Philemon Nyambati, who is from AICQ International, helping us with more answers to the questions that we could be having. I invite you to send your question to 20933 or WhatsApp on 0717 400 555, and we'll be looking at that in a little while. But before that, we continue with where we were in the previous hour, and we touched a lot on matters to do with joints, and especially what children present with in terms of the problems or anomalies that would like to be attended. And we've also seen among adult population what we can look out for. And so, Dr. I'd like to indulge you on this. Probably you've had misconceptions from people who would say probably there are myths and about joint health that you often come across. And could you debunk some of them, especially when it comes to joint issues you've had, maybe from adults, from children, regarding the health of their joints?
Yes, thank you. So there are a number that people actually have the myths. One is that if there's clicking of joint, there must be a big problem. That is what causes arthritis. But it's not true in terms of this sense. If there's pain, if there's clicking with joint pain, then that shows that you'll need to seek medical treatment, because you can think there could be something within the joint that's locking, and that is what is causing pain. But if just clicking as you're walking, that tends to happen because there are air bubbles, like the way it's like breaking your knuckles, something like, if you can say something like that, where there's a popping sound. So that happens if there are air bubbles within the joint. And so if it's trapped within the joint, it can pop, and that can cause a click. Another thing is that using cold water or hot water, that can cause problems within the joints. So cold water helps with just stimulate the body, because the body is exposed to stress, and so there's that where the body is invigorated, so it does not really cause. Another thing is where when you're in a cold environment, when you're living in a cold environment, this is what causes arthritis. But it is not so. What happens is just that most likely someone has a condition. So there's what happens with the cold, when you're in a cold environment, the atmospheric pressure is lower than within the joint. And so that is what causes tension and pain. So in a reduced joint, someone will actually feel pain. But there are also changes in weather that can, for some people it's possible to have pain when they're exposed to cold weather. But this is because of if there's a reduced joint space and there's the change in the atmospheric pressure, then the person tends to have pain. So treatment is either you have warm compresses or making sure that you're warm just to help. Yes, so those are the myths. The other one is when you take bone breath, you'll have strong, like your joints will be produced. So bone broth is good in terms of it's high in protein, but in replenishing the joint fluid itself, it does not actually replenish. It's just that it's a source of rich source of food. It's rich source of protein and other things. Actually, what happens is that when the body absorbs it, it's able to go to the joint itself, and those minerals are what help in production, but not itself directly causing that. So that's one thing. Yes.
Wow. lots of myths, misconceptions there, and probably ask. You've talked about the issue of extreme weather. I need to get some clarity. What if there is somebody lives? Well, they were living in Kenya, for example, where the weather is fair, and then they go somewhere that it's very very hot, probably Dubai, probably someplace very very extreme in terms of weather. What can you say would be the effect on their joints or on their bones in case they do the traveling?
It actually, for hot environments, there is not much change because we're in the equator, we're in the hot place, exposed to sun. But in like in Dubai, also there's sun, so that doesn't really change much. What actually changes is actually like when you go to a place that's very cold, or they do not, or they do not get sun, so there's not a lot of vitamin D. So with that, there is your bones do not, because the sun is what is a rich source of vitamin D, which is absorbed by the skin. So lack of exposure to sun actually now causes problems with bones. Actually, you need to supplement your vitamin D just to help the body. That is what I know can cause changes. Yes.
All right.
Especially in the bone sector. But also if already there was reduced joint space and you're exposed to a cold environment, that change in pressure is what now causes pain. Yes. Thank you.
Thank you, Dr. Let's look at some of the comments and questions coming through regarding the health of bones. And there is a friend here listening to us from Sotik, Tai Kim Tai, saying, my mom is kind of paralyzed since the year 2015. Her left arm and leg are generally weak. She has been to hospitals, but it has not helped. What and how can she be helped, or can she get help? Yeah.
Thank you for that question. That looks like a specialty in probably medicine, because based on the fact that he's talking about weakness on the arm and the leg, it's possible that there was either a stroke or something that could have happened. And so when stroke happens, what can happen will be there's weakness of the arm and the leg. And so recovery tends to be a long process in terms of there's nothing like medication that can replenish that aspect, because it's the brain's response that was supplying strength to that area that is affected. And so treatment tends to be physiotherapy to try and retrain the brain, if I can use that word. And so it's a journey, it takes a while. The best I would recommend is the fact that the mother hasn't improved. It would be good to see probably a specialist. I'm not really a specialist in that area, but that's the advice that I can give. Either see a physician or a neurologist just to see what could be the problem if further investigation is needed. But recovery tends to be slow. It can take a year, 2 years, just depending on how bad the injury was or what caused it. That's what I could advise. Yes.
There's a listener here who has sent a message. The name is Gadoni, saying, kindly help. I have tendinopathy. I don't know if I pronounced it well. Tendinopathy.
Pronounced it excellently.
Thank you.
Yes.
Thank you. So they need some help. She needs help here.
So tendinopathy is whereby there's can I say like inflammation or the tendon. So between what helps attach the muscle and the bone is what is called a tendon. So in that junction between the tendon and the bone, At times, what happens if you have excessive activity or any injury, it can wear off a bit, and so it presents with pain. So it's called tendinopathy. So that can happen. It can happen in the knee. It can happen at the level of the foot as someone is walking, mainly probably when walking down the stairs, because at that point there's quite a lot of resistance. That's when there's greatest resistance as you're going down the stairs, and so someone can feel pain. So for tendinopathy, the best treatment will actually to be fast for you to say that it is the one you're examined and you just give a history. Is there pain on movement? Is it relieved by rest? So initially, actually, treatment is physiotherapy, and for a period of about 6 weeks, because what you want to do is help stretch the muscles, and also then we gradually go to strengthening exercises. If it's still quite painful fast before, there's medication that's actually given and probably a brace just to help relieve pain and rest if especially you're doing a sports activity. The other thing that I'll advise Kadoni will be also first after physio, if physio has failed, after rest, then physiotherapy where you strengthen and retrain the muscles in case there's any weakness. What is done, there's further imaging that is done just to check if there's something within that tendon that is having a problem. At times it can have some micro tears within that, and probably that is what can cause pain. So usually treatment is to try to see if it can heal initially without intervention. There's some medications that can be injected to hopefully help that part heal. But if it doesn't, then it requires surgical intervention to try and repair that area if it's still persisting with despite all the non-operative medication, non-operative treatment. Yes.
Right. Hope that helps Gadoni there. Another question coming through from Elvis. Elvis saying, getting you loud and clear from Lamo. Wow.
Thank you.
Yeah, saying my right jaw joint next to the ears ache so much. Sometimes comes with some mild headaches on the right side. The pain is exacerbated that the last 2 weeks. What could be the problem, Daktari? Yeah.
Please repeat. There's that part of I was just trying to between the ear and.
Let me get it. The right jaw joint next to the ears aches so much. Yes. And sometimes comes with some mild headaches on the right side.
On the right side.
Yes.
Oh, okay. So that most likely, usually there's a nerve that supplies part of the face, and it's called the facial nerve. So it tends to supply part of the jaw and go into the ear. And there's also a nerve that's called trigeminal nerve. So based on what is explained, it's not specifically the joint itself, because there's aspect of it talks about headache on that side and between the ear and the jaw joint. So there's what is called trigeminal neuralgia. That tends to affect the jaw and the ear and also causing headache. Another things can cause it. It could be either something on the nerve that is pressing, and that is what is causing the pain. Some viral infections can cause pain, and even one side of the face can get weak. Based on what he's having, I think the best would be at least to see a physician just to see what could be the problem, or a neurologist just to help and assess further. That's as far as I can help. There's some medications that are actually given because it looks like more like a nerve pain, but the best will be first to see either a physician or a neurologist just to see what could be the problem. Yes, thank you.
Right. Thank you. That helps, Elvis. Thank you for joining us from Lamo. All right. Another one here saying, hi, Jackson and Daktari. Hi to you. I have worked for a year in a logistics company where I've been involved with lifting heavy weight goods.
Yes.
Like 2 months ago, I began feeling bottom back pain around the waist.
Yes.
And then after seeking treatment, the pain moved to the center at the back. Please assist.
Thank you. So low back pain is one of the second most common causes of hospital outpatient visits after a HOMA or upper respiratory infections. And so that's something that is common because this is now the working age group that happens. The fact that he's working in a logistic company and lifting heavy things. So what happens probably, it depends on the fact that he's lifting heavy stuff. It depends on how someone is lifting. If one is lifting by bending forward, that actually tends to cause pain because by nature, we are supposed to squat, then lift something, not bend forward like bending without squatting, because what you want to use is your core muscles or the abdominal muscles. And so one thing is initially, yes, that's what probably we were used to. We used to seeing our mothers, our sisters, even us washing the house, bending or kulima. So that it's usually called bad back hygiene, because this keeps a lot of stress. You're using your back muscle to lift. There's a lot of stress there, not the core muscles, which is your pelvis and the abdominal muscles. And so why he was having pain, mainly it's because of that stress when lifting. That's why he was talking about the lower back or he said what back? Back.
The moved from saying the pain, the
yes,
back pain
yes,
around the waist,
the
then
waist,
it moved
exactly,
to the center of the back.
Exactly. Yeah. So that's what happens. So with back pain, there are a number of things that can cause pain. Usually, there's the muscles of the back, there are the joints of the back, and there are usually nerves that are there and discs. So when you have pain that's specific only to the back itself, most likely that is muscular, and so it has been strained, and that's why he was having pain. If there's any pain that goes to the foot, having numbness or tingling with back pain, that shows that there's a nerve that was stretched and actually is causing the pain. So for him, treatment initially will be first medication just to help with the pain that he's having. Then it's good to see a physiotherapist. But first, before that, we'll just try to rule out, is there any infection? Is there any injury? If there's no injury, most likely it's the muscle that a spasm or has tightened on the back, and that is what is causing the pain. So initial treatment is to that's called back stretching exercises, just to help relax the muscles of the back. Then what is called core stretching, core strengthening exercises. So you use the abdominal muscles are strengthened because they tend to get weak. And so what you need to do is after medication and that has resolved for a period, then you start exercises so that you recover. Then you need to be shown how to lift weights, how you sit, how you push things, how you pull things. So that actually what we would advise is using the core muscles just to help push things. And then if it's lifting heavy things, you squat and lift. Yes, so that's what I will advise the gentleman. Yes.
Thank you so much. Well, still learning more about the health of our bones, and tonight hosting Dr. Philemon Nyambati to answer your bone health related questions. Keep sending them to 20933, WhatsApp on 07.
Welcome to the world of Hope Media, a media unit of Christ is the Answer Ministries that is committed to spreading the gospel of our Lord Jesus Christ through the transformative power of media. Hope Media is dedicated to utilizing various forms of media to spread the message of hope, love, and redemption to all people around the world. Hope Media consists of various units that work together to achieve this goal. These units include Hope FM. Hope FM is your number one Christian radio station, offering you discussions on current day-to-day issues, inspiring music, life-changing sermons, and news updates, broadcasting 80% in English and 20% in Swahili, with listenership of over 12 million every month. Hope TV. Hope TV programming is designed to inspire, educate, and challenge the viewer with wholesome content to reach various demographic groups, children, youth, and adults, both male and female, with viewership of over 24 million every month. Hope Recording Studios. Hope Recording Studios is a state-of-the-art recording facility that offers high-quality recording, mixing, and mastering services. It is designed to meet the needs of musicians, artists, and other creative professionals who require top-notch recording facilities. Hope Creative. At Hope Creatives, we believe that inspiring graphic design work doesn't just happen. It takes the right people with wild, out-of-the-box ideas committed to the same ideals, working together to make it happen. We listen, we learn, we brand. Hope Digital. Hope Digital is a creative digital unit within Hope Media. We are driven by a passion to creatively express ourselves while influencing you with the same creative energy in online spaces and beyond. At Hope Media, we believe that media can be a powerful tool for spreading the message of hope as well as grow your business through advertisements, and we do this with excellence. For more information regarding our services, please visit www.hopemediakenya.org or call us on 0709 861 180. Hope Media. We keep hope alive.
Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer.
What he is able to do, and even the days to come, believing and trusting him for the best that he is just about to do in our lives. 20 minutes to 9 o'clock. You're listening to Breath of Heaven on Hope FM. Listen and live. And tonight we are focusing on the health of your bones, specifically looking at joint health. And I see questions that are diverse, but I'll just send them to Dr. and he will give us some sort of help regarding that. And so just before we took that break, Dr. we were talking about lower back pain being a very, very common occurrence and the outpatient and all that. And probably there's something you wanted to add, because there's a question that I will be asking in relation to that, that you will also be responding to, but you could add a bit of what you wanted to share.
Yeah, thank you. Actually, I just wanted to say, so the physiotherapy and rehab and strengthening does not stop there. So once someone, actually someone needs to know that first in the acute or in the phase where they're having a lot of pain, yes, we first, after ruling out if there's any infection or any injury, then the physiotherapy has started. It's given over time. And so for a period of about 6 weeks. So the recovery does not happen immediate, not like in 2 weeks, this will happen, because it's a gradual recovery. And so physiotherapy, what we actually, when you see the patient in the clinic, we advise that this will take time. And so we give a period of about 6 weeks. If by then there's no recovery or it's getting worse, then you'll think there's something. So that's when we order an X-ray or further imaging just to check if there's anything. And so that's what I just wanted to let the gentleman know. So first, the treatment is initially physiotherapy with medication. The fact that he talked about now pain is going up, it will be good just to be seen and see if there was any form of physiotherapy or rehab that was done on the back just to help strengthen. And now this will be not only like when someone gets healed, they stop. It will be good to actually continue with this even in daily life. Yes. Thank you.
Thank you for that as well. Let's look at this one. Just in relation to that, probably you will give some bit of advice here from, this is a lady.
Yes.
She says, good evening, Jackton and Doc. Good evening to you.
Yes.
Saying, yes, I had a CS in 2021 and I've been having lower back pain, the bum area, especially when I sit for long. What could be the problem?
So that happens So with pregnancy, what happens is that the ligaments around the pelvis and the joints become a bit lax, first because of the hormonal factor and also because of preparation for childbirth. And so what happens with what she's complaining about, because it's at the bum area when sitting. There's what is called the coccyx at times, where someone sits in between that bone, that can cause pain. It's called coccydynia. That tends to happen because that place is lax, and especially if you're sitting for a while on a seat that's not well cushioned, it tends to cause pain. Another thing that can cause pain is because of how the pregnancy, it pushes the gravity more anterior, and so that helps, that stretches the muscles itself and the bone, and so that tends to cause the back pain. The injection itself does not really cause the pain because it's just a small tiny spot that where the injection is put within that space and helps numb the area so that it's easy to remove the baby. And so it will be good probably to see probably a clinician and an orthopedic surgeon just to see what could it be. Yes, but those are the things that can cause pain because of carrying that pregnancy, and then after that the changes that happen because of it being stretched, and so that's what tends to cause the pain that she's having. Yes.
All right. Let's look at another one here from a listener who says, hi, Daktari. I had right knee pain, which lasted for several weeks. And when I tested my uric acid, it was as borderline. A doctor later gave me some supplements, Forte, for a month. I'm still on it. Probably would like to hear your thoughts on the situation that this listener had.
So, in terms of so what happens is that knee pain can be caused by many things. It would be good to know probably, was there any injury? Was there any injury prior to that? Did it happen when the person was active? Was there any form of swelling? So uric acid is a byproduct, is where the body, there's a metabolite that happens and produces uric acid. If it's borderline, then usually what is recommended is actually observation. Supplements may help with the joint itself. It does not go straight to the joint, but it just helps with the person's well-being. But however, if the uric acid is high, then that can cause swelling and pain, and where there is what is called gout that can happen in that. And that happens because the body is not removing the excess metabolites into the system, and so it comes into the joint and causing pain. It happens if someone has taking quite a lot of alcohol or quite a lot of red meat, because these are very high in the it's called purines or proteins, and so when they're trying to be metabolized, they can be, if someone is predisposed to that, then it cannot remove the uric acid, and that's why someone is told to stop taking red meat if they have been found to have high uric acid. So the main treatment is, if the pain has gone, it will be good just probably to go back and test if the uric acid has gone down. Yes. And then it will be good just to check your diet. What are you taking that is bringing all this? Taking a lot of red meat? Are you hydrating enough? Yes. Yes. Thank you.
All right. Another one here has a question now, and saying, my elderly mom was told she doesn't have enough synovial fluid, which is causing excruciating pain, especially on the legs. She is under medication. What else can we do to help increase the fluid? Any diet we should focus on?
So what happens is, as I talked earlier about the age group, there's the age group that's between, as you go 50, 60 onwards. So what happens with our bodies? There's wear and tear, and this happens for people who are. There are some who are more predisposed in that if they are heavy or overweight, there's a lot of stress that can happen. So first, the diets that have been found, not that it increases synovial fluid, because it's not the synovial fluid that is causing. There are a number of factors that happens, especially I think what she talked about, he talked about was joint. Was it at the knee? Did he say? He didn't really say. But what actually happens is that if there is any reduced space in the joint, that tends to cause pain. Another thing also, because there's not enough cushion. So there's usually change that actually happens with what is called arthritis, because this happens with wear and tear. There are those that occur due to injury, and there's those that occur due to wear and tear. Only that for some, especially if you're heavy, there's wearing off of the joint. And so diet, what is done is what is called anti-inflammatories. They do not heal or stop the arthritis itself. It just reduces the rate of progression. So the major thing that is done to help, that has been found to help reduce joint pain, especially for a person with arthritis or just reduced joint synovium, is actually weight loss. Because when you lose weight, the body does not have a lot of stress to do that. Fish, legumes, nuts, citrus fruits, all these help with just health, and actually joint does not replenish the joint fluid itself, because this arthritis is an irreversible condition once it happens. So usually treatment is especially if there's knee arthritis, there's physiotherapy, that because with osteoarthritis, it's a complex condition whereby there's, especially if it's the knee, there's the element of the muscle and the joint itself. It's at the hip, it's mainly the bone itself. And so in the hip, the main cause of pain is the joint space. It's reduced, and so there's bony on bony attachment. If it's at the knee, there's the element of muscle and there's the element of the joint itself. And so that tends to cause pain. So treatment should be focused on strengthening the muscles, and medication is given just to help reduce that pain. And if still there's still quite some pain, there's an injection that's given within the joint, especially if it's at the knee, and that helps relieve it. If not, treatment is knee replacement or hip replacement. That is if there's still a lot of pain and the person cannot walk for long, is not as active. Yes. So that is usually a stepwise. So in terms of if there's medication to help, it's mainly in young people. What is done is an injection that's given, a hyaluronic acid, in young people who do not have any changes. They just have knee pain, and that is what can be done. But if an elderly person, that is difficult because there's been wear and tear. Yes. Hope I've been able to at least answer as best in terms of what he's asking.
Yes.
Yes.
All right. And we'll look at another one here from a mother.
Yes.
She's breastfeeding a 10-month-old baby, saying, I'm a breastfeeding mom of a 10 months baby. My knees pain when I bend. Are bones weak because of breastfeeding, or what might be the problem? Thanks in advance.
Thank you. So with breastfeeding, because this is a high rate of loss of calcium because the child is really breastfeeding. So a number of things can possibly, just depends on the number of factors. There's if the person is not as active, And so when bending, what happens is within because she's talking about when she's bending, she's feeling pain on the knees. There's what is called quadriceps, or the thigh muscle. That is what comes to attach on the knee. And that, with time, what happens is that it changes its structure. She didn't really mention her age, but the structure tends to change of that tendon, and that is what causes pain on trying to bend down. Initial treatment, actually, if there's no infection or anything, treatment first is stretching exercises and strengthening just on the knees. Then for breastfeeding, it's good to have supplementation, especially for calcium, especially because the child is really breastfeeding. Yes, so in addition to the diet that she takes, for a person who's breastfeeding, it's good to supplement. Yes.
All right.
Thank you.
Calcium. All right. Thank you, Dr. Let's look at another one here from a lady all the way from Saudi Arabia. The name is Caroline.
Yes.
Said, so I joined the travel industry last year, 2023, and by the second month, my left knee and ankle plus also the elbow started to ache because of pain. So it's the left knee and the ankle and the elbow started to ache because of pain. I had to adopt, or is it adapt?
Adapt, yes.
Adapt.
Yes.
And I've dressed heavily and put on a bandage and was able to survive last year. So by December last year, I traveled to Middle East.
Yes.
And immediately after 1 week, my left knee started to produce a sound, a make up a grrr sound.
When like a gritty sound.
Yes. When I'm going downstairs and upstairs, and also while squatting. I'm not feeling any pain, but the sound itself is so annoying. So could there be an underlying problem?
If there's no pain on going down the stairs, or what we usually fear is if there's any gritty sound with inability to bend the knee, like if the knee is straight, you can't bend it, or if there's a gritty sound and you're having a lot of pain, like sharp pain, then that shows that there could be something within the joint. But when you're having a gritty feeling, it would be good probably just to have a simple x-ray, just to see the doctor and just see. But generally, if it's painless, generally it's not an underlying. Tends to be because of trapped air bubbles, and that's what tends to cause the feeling of gritty or a popping sound or clicking sound. Because she talked about when going down the stairs on squatting, she feels some click or some grr sound. If there's no pain, I will watch and wait. For the swelling of the elbow, she talked about elbow, knee, and ankle. So it will be good probably also to see the physician, because it's not normal just to have swelling that can occur at once, because a number of things can cause it. Usually, if the swelling has been in multiple joints at the same time, there's a bit of the stiffness, morning stiffness, in that it happens in the morning and someone cannot function, and that's been there for more than 6 weeks. It would be good just to seek advice, just to know what it could be. Yes.
Probably one more here, and then we conclude.
It's okay.
Coming so many. Wish we had more time for this, but thank you so much for answering them. This one says, my name is Kenneth from Mombasa County, a place called Kwapunda.
Yes.
I do juice business, which involves a lot of cold drinks, cold water, and ice. Early mornings, my hands sometimes don't respond or become stiff. What could be the problem?
So early morning, so that is one thing that can happen. There are a number of things that can happen. He talked about stiffness of the hands in the morning. Then, because it seems during the day he's okay. It's not specific to the business itself. it will be good just to be seen, because what happens, there's what is called rheumatoid arthritis. I'm not saying that's what the person has. It's characterized by, at least for a period of 6 weeks, where you have morning stiffness of the hands, you cannot use them, you have swelling and pain. Then as the day progresses, someone is able to use it. So if you stayed for a period of 6 weeks with that, it will be good to see at least a rheumatologist or a physician just to check if there's anything. Another thing that can happen, especially with cold, because with cold, what happens for some people, the arteries, where the vessels that supply blood to the fingers and the hands tend to be a bit constricted, especially with cold. And so what happens is that the hand can be white and feel stiff. So that's another thing that can happen. So at least I would advise at least to see the closest physician just to assess what could be the problem. Yes, for remedy, initially, actually it's exercises to just help move the joints, but the fact that it's something that has been persistent, I'll recommend just to see a closest physician at the place you are at. Yes.
Right. Well, time allows us to look at those questions tonight, and God willing, next time we'll carry on and look at another subject even for the other questions that we'll be addressing. So, your concluding thought regarding what we discussed tonight, especially for somebody who is saying, what is the issue of joint pains becoming so common these days? It seems it's becoming more prevalent.
Yes.
And there are current predisposing factors that need to be addressed. Probably as you'll be concluding, you may answer that. And then somebody who would like to book an appointment at AICQ or any of your clinics, how they can go about it.
So with joint pain, first, why it appears more common is, first, there's awareness and education. And so that is one thing that has made it aware. So we're able to actually express ourselves and actually say. Another thing is our lifestyle. And so whatever we eat or drink, it's at a risk of predisposing us to these joint pains. And also our lifestyle. So if you're overweight or obese, that actually predisposes you to more joint pain, because the body is under quite some stress in terms of lifting your body. And so what we recommend remedy, it's good to lose weight. And then when you're active, make sure that you have proper running shoes, proper walking shoes, because even there's the side where someone is overweight, and then there's the side where you're active, but you do not have proper running shoes, you do not stretch. All this predisposed to joint pain. And so it's something that is possible to be treated. And initially, the best is first make sure that having a healthy lifestyle, make sure you're well hydrated, stretching, and if still it persists, it's good to see a doctor. For where we are located, so we are AICQ Children's Hospital of Kenya. We are located at Kijabe, and our clinics we have a clinic in Nairobi at West Point Building, 4th floor. The number is 0733 790 421. I'll repeat again, 0733 790 421. Our number at the hospital itself at Kijabe is 0733 770 653. I'll repeat, 0733 770 653. We have clinics Monday to Friday from 8:30 to 4 p.m. Our email is info@curekenya.org. So our motto is help kids heal. So we help we treat orthopedic conditions for children. Yes.
What a joy hosting you tonight, and thank you so much for coming through.
Thank you.
And we pray for you even in your practice. God will continue to grant you more wisdom and strength.
Amen.
And protect you.
Amen.
Amen.
Thank you. I'm grateful.
Yes. And also send our love to the rest of our friends there at QA International.
Thank you, Jackton. It's been a pleasure having
all
you having me.
All right, so you're welcome. Well, that's just about it tonight on Breath of Heaven, as we'll be having this conversation revolving around the health of our bones,